I'll start with the undergraduate education, the current situation. Of course, unfortunately, back in the 80s of the last century, most of the medical doctors did not consider substance use disorder as a medical condition. And as such, they did not consider treatment for these patients as their domain of treatment. Moreover, they had negative perception of the patients with substance use disorder, for example, considering them criminals, dangerous, or treatment resistant. And this was associated with negative attitude towards these patients. Back in 1991, Okasha Institute of Psychiatry at Ain Shams University, Egypt, was the first to develop an inpatient addiction treatment services at a university level. This was followed by the development of outpatient clinic, which was at that time 1 day a week. Now it's currently running daily more than one clinic. This development in the services was the cornerstone in the development of addiction medicine teaching and clinical training. انتوا عارفين كويس قوي احنا ما نقدرش نعمل training ولا teaching من غير ما يكون عندنا مرضى. في وجود المرضى نقدر نديفلوب التريننج بصوره واضحه، ما يبقاش theoretical بس، يبقى فيه clinical كمان teaching. Starting since the mid-90s of the last century, substance use teaching became included in the psychiatry curriculum of the undergraduates in the Faculty of Medicine at Ain Shams University, where it included one session to teach substance use disorder clinically, which aimed at that time for the following. The first thing, الأويرنس. احنا زي ما بنقول الطلبة جزء من المجتمع، فالطلبة نفسهم كانوا بيوصلوا لنا at the last year of their training, they are not aware that addiction is a disease. But first and very important goal was to raise the awareness of medical students that addiction is a psychiatric disorder, improving medical students' attitude toward patients with substance use disorder, giving an overview of the common substances of abuse that are available in Egypt, discussing the outline and the management plan of patients with substance use disorder. Ever since the introduction of addiction medicine education for undergraduate, the education has passed through many phases of development to improve the content of the curriculum. And this model was further applied in other medical schools. مفيش أي medical school دلوقتي في مصر إلا ولازم بتدرس وبتدي اهتمام للaddiction medicine. But at that time, there was no other medical school that have an inpatient or outpatient services until 2010, when Qasr Al-Aini Department of Psychiatry, Cairo University, opened an addiction treatment services, which made clinical teaching of addiction medicine feasible. Currently, some of the universities have outpatients and inpatients. Not all the universities, but most of them have both services, and they develop the training and teaching of undergraduate students. With the changing standards of medical care being brought about, now it is indispensable that all physicians become able to recognize chemical dependence and make appropriate referral. احنا مش طالبين من الناس ان هي تعالج عيان الادكشن، طالبين ان هو ايدنتيفاي، على الاقل يساله. احنا في التريننج كنا بنتفاجئ انه الناس ما بتسالش اصلا على فكره الدراج يوز ولا الالكول يوز ولا الكلام ده كله، فكره انه ازاي تو ديتكت كيس فور فيرذر ريفيرال later on. فده المفروض ان هو يبقى جزء اساسي من taking history, and we were able to make our students cautious regarding neglecting to ask this. To fail to do so should be seen as negligence, since the resources for treatment and specialized medical expertise are becoming readily available around the country. Despite the fact that the medical curriculum have only total of 11 days in Ain Shams University for psychiatry, we have 1 day dedicated for teaching addiction medicine, theoretical and clinical teaching. Theoretical part, we give an overview of substance use disorder, including alcohol, behavioral addictions, as well as nicotine dependence. And in the clinical part, the students get the chance for psychiatric assessment of the patients with substance use disorder, followed by discussion of the management plan and the prognosis. ومن المفارقات اللطيفه ان احنا كنا لغايه قريب قوي الطلبه بتوع كليه الطب طبعا وجزء كبير من الاودينس ار فيزيشنز، فكان سؤال اساسي في السبيشال هابتس ان نسال الناس هل بتدخن كواحده من السبيشال هابتس. وكنت دايما اقول لهم انه ما ينفعش اسال على حاجه او احط حاجه فيتال كواحده من السبيشال هابتس، ما ينفعش. يعني ما ينفعش يبقى العيان بيشرب مثلا شاي بلبن ايكوالز انه بيدخن وبياخد حاجه ممكن تعرضه لكانسر لنج. فكان حتى كونسبت انه السجاير ما ينفعش تتحط في السبيشال هابتس دي كانت حاجه جديده على الميديكال education. What about house officers or interns education? What about the current situation? Of course, for the past 23 years, we have managed to do training for house officers. Starting from 2000, year 2000, we are training the house officers in addiction medicine. طبعا ده كان تطور كبير جدا ان احنا قدرنا ان احنا الدفعات بكاملها ناخد اسبوع اللي هي دوره علاج الادمان. فدي كانت بالنسبه لنا بدايه موفقه لينا، وفي بعض الجامعات الاخرى بداوا يعملوا ده بعد كده تباعا. ان احنا بنستقطع هذا الاسبوع من الشهر بتاع الانستيزيا، التريننج بتاع الانستيزيا، لان هم في التريننج بتاع الانستيزيا في الحقيقه ما بيحتاجوهمش كتير. فده كان برضو من الحاجات المهمه جدا في تطوير التريننج اوف ذا هاوس اوفيسرز، وخاصه ان دول اللي احنا كنا عايزين to draw their attention for the fact that they should be able to identify patients with substance use disorder and make referral, because mostly the patients will go to these doctors in other specialties with what is known as medical sequelae of addiction. So they should be able to identify addiction and refer the patients. The training is now done in nearly all faculties of medicine all over Egypt. Given the extensive range of medical complications and comorbidity that often accompany substance use disorder, all medical doctors need some basic competence in the assessment and management of substance use disorder, and it's highly important that medical doctors recognize the abuse of prescription drugs and their impact on health of the population. Because this category of the patient will do doctor shopping at the other medical specialties. بيروح للدكاتره اللي من التخصصات الاخرى احيانا يشتكي من painful conditions، وفي بكره سيشن مخصوص عن management of pain بالذات لو العيان اصلا addicted، وبيبدا ياخد prescription drugs، والprescription drugs طبعا دي as dangerous as illicit drugs. Moreover, subsets of substance use disorder patients will need medical attention from well-trained specialists in addiction medicine, so the interns need to know how to refer for such specialized services. And the current curriculum for these interns contain definition and diagnostic criteria of substance use disorders, including abuse and dependence, and including, of course, different types of drug abuse. How can a family identify an addict and help him or her to seek treatment? Addiction as a chronic relapsing disease, case presentations and history taking, different subtypes of substances abuse, including street names, signs of intoxication and withdrawals, behavioral addictions, pharmacological treatment of addiction with the focus on drugs used in detoxification. زي ما كنا لسه بنقول حالا، وكان حتى الدكتور محمود معانا في السيشن اللي فات وكان بيقول انه في بعض البلاد الميثادون ده بيبقى ديسبنس بواسطه البرايمري كير سيرفيسز، مش محتاج سايكاتريست يعني، فلازم يبقى تريند كويس. Overview, of course, of the main psychological treatments for addiction, which includes the motivational interviewing, CBT and relapse prevention, as well as family psychoeducation and 12 steps program, smoking cessation, medical sequelae of addiction. What about addiction counselor education, the current situation? Because, of course, we have a lot of people who are recovering addicts who work to run halfway houses. احنا عارفين طبعا انه هم جزء من المنظومه مهم جدا. They run halfway houses and they share in the multidisciplinary team involved in addiction treatments in the other hospitals and in other treatment addiction programs. So they are very important to be trained. في الحقيقه هم كانوا بيشتغلوا القصه دي بيزد على ان هم ريكفرنج وبيزد على ان هم انهوا 12 ستيبس بروجرام وفقط. لكن طبعا we started to do training. Actually, training started outside the university. It started in 2003 by Freedom Drug and HIV Program, which is an NGO in Egypt, and has been working collaboratively with international associations as NADAC and NECAP and ISAC, and they were interested in producing recovering addicts who are very well trained and certified. They are considered to be nationally certified addiction counselor level 1 and level 2. In 2007, UCLA became the lead group for curriculum development for the UNODC treatment program. This is a worldwide network of training centers in the area of substance use treatment, and Al-Qasr Aini training program for addiction counselors was based on 10 years partnership with UCLA, and a lot of our colleagues were also sent in these fellowships for US. In 2018, General Secretary of Mental Health and Addiction Treatment started to provide certified professional training for people interested in working in the field of addiction counseling. And these people could be either recovering addicts with 2 or more years of recovery, and also they could be people who are not by themselves recovering addicts, but they are mental health workers, psychologists, social workers, occupational therapists, as well as nurses, and including family members of some patients with addictive disorders who are interested in doing counseling. What about addiction specialist education? And this also specialists and consultant, but mainly specialists. Most of the currently trained addiction specialists have their training or certification from Western countries and international societies. For example, Hubert H. Humphrey Fellowship Program at Johns Hopkins University. It was based at Johns Hopkins University till 2005. Then it became at Virginia Commonwealth University from 2006. Myself, I was one of the fellows from the Hubert Humphrey Fellowship. We have Dr. Medhat Basuni, who was also a fellow with me in the same year, 1998-99. We have 2 of our now consultants, but they were students at that time, who were trained also in Hubert H. Humphrey, Dr. Walid and Dr. Muhammad Hamshari, and they unfortunately both traveling, so they are not with us now. Also, we have the Booker-T International Research Training Program at UCLA, and ISAM certification in addiction medicine. In 2020, under the care of Professor Ahmed Okasha and the Vice President, Professor Medhat Basuni, the Egyptian Fellowship of Addiction Psychiatry was started, and eligibility criteria include having doctorate degree in psychiatry or Egyptian fellowship, and it's a 2-year program. There is a general professional diploma in Cairo University, which is to prepare students to work in combating drug addiction, and it has specialized courses for the interdisciplinary approach with professors from the field of psychology, psychiatry, and sociology. So what about facing the gap between the present state and the future of addiction specialist education? Of course, the future vision of training should aim at addiction specialists who can provide unsupervised, comprehensive, evidence-based medical care in addiction medicine, tailor and design and individualized plans based on comprehensive psycho-social, spiritual assessment of the patient in his or her own cultural context, work with different patient populations effectively, give our patients, their families, and our community a better quality of life, interact with other disciplines, including medicine, toxicology, psychology, social workers, occupational therapists, and allied health staff, lead a multidisciplinary team, serve in research, teaching, and administration, supervise junior residents and medical students, share in the development of prevention programs. Also, clinical training aims at giving care and giving sufficient exposure to special groups, because these groups are still under diagnosed. and care for them is still lagging behind. These groups include women, children and adolescents, elderly adults, dual diagnosis patients, patients with medical comorbidity. Of course, as you heard all of us discussing in the last session about HCV and HIV, other special groups. The clinical training also must include training about new drugs of abuse, which, of course, every day there are new drugs of abuse that are added to the list of drugs of abuse. Focus on behavioral addictions like gambling and gaming, supervision of different psychotherapeutic approaches used in the treatment of substance use disorder. So supervision is a very important item in doing the right psychotherapeutic approach. License to practice psychotherapy in the field of addiction medicine should be dependent on having specific number of supervised practical hours. Also, we should put into consideration that there is, as we said, biopsychosocial model. Although Egyptian population is fairly homogeneous, yet we have only 0.4 of different ethnic groups. However, they should be also considered in our training for substance use disorder. We also have patients coming from different Arab countries, so we should have programs that are culturally, ethnically, and spiritually sensitive. We should be able to recognize the impact of culture on the development of substance use. We should also be having a competency for working with forensic population, because these are the divergent programs, and they are these patients are present everywhere in the prison. So either we have to be able to deal with the referrals from the prison or to do programs in the prison itself. So we should be able to do evaluation and rehabilitation of the individuals within the legal system. Of course, psychopharmacology, and we were just discussing the opioid substitution therapies. Those who are going to be specialists or consultant in the field of addiction medicine should be trained in using these opioid substitution therapies, as you all know and noticed that this field is new in Egypt, and people should receive proper training and education about it, and of course be knowledgeable in the evidence-based practices and share in the development of national guidelines. As we just mentioned, when we started the opioid substitution programs, we did what's known as the national guidelines for the use of methadone. Also, research skills are required, because research in addiction in our country still also requires a lot of practice or a lot of research. So we should be able to critically appraise research publications and assess its applicability to our clinical practice, to design and perform and report quality assurance studies, and to be competent in designing and performing different research studies. Of course, continuous professional development is very important for all the physicians, and particularly in an area that is still growing rapidly as the treatment of addiction medicine. Telepsychiatry, in the era of COVID, we all noticed that it was a must to do a telepsychiatry service for these patients, and otherwise the rates of overdoses would have increased remarkably. So telepsychiatry continues to be a growing component of psychiatry, including addiction treatment services. So competences in doing telepsychiatry should be one of the competencies that any addiction specialist should be able to do. And this is the exciting news that the International Society of Substance Use Professionals, now we are launching the national chapter. This is an exciting new professional development opportunity. Of course, the opportunity includes a lot of aspects, but mainly the professional development opportunity. We are going to discuss now the International Society of Substance Use Professionals after just commenting on some of the challenges that face us. We have a small number of addiction medicine specialized faculty. Some people still hold the same negative attitude and lack interest in working with patients with substance use disorder, and certifications that are available. The qualifications for these certifications are sometimes difficult for some people to be able to acquire these certificates. Thank you, and I will immediately go to the next part, which is launching of the International Society of Substance Use Professionals. I will start with our partners who helped us a lot to develop this national chapter. Unfortunately, the chief executive was supposed to be with us, Joanna Travis Roberts, but she has an obligation, and of course we were delayed in the session. So with us now is William McGlynn, Senior Advisor, Office of Global Policy and Programs Demand Reduction Bureau of International Narcotics and Law Enforcement Affairs in U.S. Department of States. So, Mr. William, is he with us?
Yes, Professor Amany, thank you so much, and thank you all for letting me join you for this important event. And I was particularly taken by Professor Amany's excellent, comprehensive discussion of the landscape of all the great achievements that Egypt has made in the field of substance use disorder, addiction, and strengthening the workforce. As you heard, I work for the U.S. Department of State, and our goal is to increase our collaboration regarding substance use disorder, drug prevention, and treatment. And we have had a really strong relationship with Egypt, which we appreciate very much. We have engaged very much with the General Secretariat of Mental Health and Addiction Treatment, which has done outstanding work, and as well as with your civil society and your universities. Again, I think we're all learning a great deal from your experience, and that is helping us all do a better job globally in dealing with what is an international problem of substance use. One area I wanted to highlight in particular, though, is, of course, with the inauguration of the ISIP, International Society of Substance Use Professionals chapter. We are very, very happy that Egypt will be part of the national chapters. Again, because you bring so many, so much talent and experience to this issue. But again, our partnership has been very strong, and we appreciate that. The International Society of Substance Use Professionals, we see that as a home for everyone who is doing anything on this problem. Not only top experts like you have here, but individuals, people in schools, teachers. So I encourage you all to join ISIP. And I think we have found that the national chapters have just brought this effort together in a way that reflects the national priorities and the particular circumstances of the country. We have followed with great interest what you've been doing on things like recovery, the program for helping people who have overcome addiction, but the next step, such as the new START program. Also, we've seen some very interesting things on how you've engaged some of your most respected personalities and individuals to encourage them to get in to consider addiction treatment, such as the high-profile soccer player Mohamed Salah and the other people who have been involved in that effort. I think the other thing I wanted to highlight too is you will see in ISIP, and I encourage you all very much to take a look at the website, ISIP.net, ISSUP.net. There's a vast set of connection with many curricula, and that includes the universal treatment curriculum and the universal prevention curriculum, and several of the specialized curricula that Professor Amany as mentioned. Again, we're all learning from each other, and we will look forward to having Egypt help us improve all of these curricula based on their experience. And with that, let me just congratulate you, Professor Amany, and the Akasha Institute for leading this effort. We very much look forward to working with you, and I'm very honored to be part of this today. Thank you.
Thank you very much, and we are really happy to have a national chapter in Egypt, and this is really will help a lot of people in their own professional development, and will help us into developing our curriculum more and our education more in Egypt, and hopefully a lot of people will be able to benefit from this. And sorry, of course, for keeping you late.
No problem.
Second, will talk to us Mr. Rodolphe Norti. Is the ISOP regional coordinator for Africa, and he has been supporting me all through the process to make it easy to launch the national chapter, and it was really an easy process with the support of Mr. Rodolphe.
Hello, everyone. I don't know if my okay.
Hello, Rodolphe. How are you?
Hi.
Sorry for keeping you late.
Thank you.
Okay.
No worries at all, Prof. Amany. So, if you don't mind, I'll just show a video about the ISOP national chapters before I deliver a brief remarks from Joanna Travis Roberts, who was really looking forward, but unfortunately, there's a meeting clash and she cannot make it.
في مشكلة في الفيديو؟ نبتدي تاني.
Is an international professional society that connects, unites, and shares knowledge across the global substance use prevention, treatment, and recovery support workforce. A key element of ISUP's work is our international network of national chapters. They connect ISUP members in their own countries and help adapt the role and mission of ISUP for different languages, cultures, and environments. National chapters bring together the prevention, treatment, and recovery support workforce at the national and local level. Each country presents its own set of challenges and opportunities for developing a trained and well-connected workforce. Our approach involves partnering with local organizations to establish national chapters that offer a wide variety of activities to those working in the field. National chapters act as a focal point where members can get knowledge, training, and valuable networking opportunities. For example, they provide members with a space to learn from experts in their own country and share knowledge through online webinars and in-person events. They also help to change the way that research is communicated and used by the workforce. By guiding and supporting effective research engagement, national chapters make a vital contribution by helping to ensure that research evidence reaches and informs policy and practice. These are just a few of the ways ISUP national chapters are making a difference, and we invite you to join us in shaping effective, ethical prevention, treatment, and recovery support services where you live. It does not matter what stage of your career you're at, we look forward to welcoming you. Becoming a member is free and it's easy to apply online. Visit our website to learn more about our national chapters and the benefits of joining ISUP.
Thank you. Hello?
Yes, yes. We can
Yeah,
see
I hope the sound was good.
We can hear you perfectly.
Okay. So once again, it's a great privilege for me to be with you today on this occasion to launch the national chapter in Egypt. I'd like to pass on the best wishes of Joanna, our Chief Executive, and Livia, our Deputy Director, and all the staff at ISOP Global. These are some brief remarks from Joanna. ISOP is a membership organization that connects, unites, and provides knowledge to the global substance use prevention, treatment, and recovery support workforce. It is free to join, and we provide members with access to professional development and networks of support from their colleagues. So when you see the word professionals or workforce, we mean absolutely everyone contributing to this field. It may be a family member, a volunteer, education, law enforcement, medical, social work. I can't list them all, but we want to provide something to support each of them. We also want them all to consider themselves the essential part of the jigsaw with the contributions they make. The individuals working tirelessly in this field are the essential force, making a difference day in and day out. We salute you and the work you are doing, and the hope that we can support that work to help you keep having that impact upon the people whose lives are affected by substance use. National chapters are an essential part of our work with ISOP's mission. We work according to the needs of the workforce in each country, but also to allow the global force to learn from all the good things that are happening in Egypt in the field of drug demand reduction. In a special way, I'll reiterate the words of William McGlynn and say thank you to the Okasha Institute of Psychiatry, who are hosting a national chapter in Egypt, and in particular, Professor Amany Haroun, who has been instrumental in setting up this chapter in Egypt. Thank you also to the 119 ISOP members we already have here in Egypt. We look forward to getting to know the workforce here and watch your country grow. We welcome you all to join ISOP by just visiting our website, isop.net, and become a member for free. We are really keen on working together with ISOP Egypt to strengthen the efforts of every individual working to prevent substance use and support recovery. Welcome to the ISOP family. Thank you.
Thank you very much, and we are so happy to be a member of the ISOP family, and thank you for the support you have given to us to launch this national chapter. Really, you made a lot of facilitations to us to make the process go smoothly. Thank you very much, Mr. Robert. Thank you, Mary.
Thank you too, Prof.
Thank you very much. So with this, we conclude our keynote lecture. Looking forward for a lot of people joining the ISOP. As just Mr. Radolf said, it's free, full of resources. طبعا I would like to thank Dr. Mayar Nawara, because Dr. Mayar has been the dynamo that is running all the papers, all the preparations. Actually, her support made the process goes very smoothly. So I would like to thank Dr. Mayar Nawara very much, because she has been really, really very supportive. And of course, the support of Dr. Maha Sayed and Dr. Nahla Sayed made the process also possible at Okasha Institute. Actually هو في خطوة لطيفة بيعملوها. احنا بنقدم على ان احنا نهوست الناشونال شابتر. اول ما بنقدم نستوفي البيبرز وكده، هم مش بياخدوا الكلام بتاعنا كده موثق، يعني هم بيقوموا باعتين لكل الارياز الثانيه اللي في مصر اللي شغاله في مجال الادكشن زي اناونسمنت ان في ناس قررت انها هتهوست الناشونال شابترز. Are you interested in hosting the national chapter? If you are interested, send us your papers. وفي الحقيقة ما حدش بعت ولا حد responded. فطبعا هم بيخاطبوا دايما الجامعات والجهات الحكومية يعني. فاللي فيها سيرفيس بقى لها مدة كبيرة. فطبعا دي يعني حاجه في الحقيقه يعني نسعد بيها. وفي الاخر برضو هو زي ما بنقول we are spreading the word. احنا Okasha Institute is hosting the national chapter, but we are there to help everybody getting more developed professionally in the field of addiction medicine. وزي ما هو قال هم مش بس بيشتغلوا مع دكاتره وسايكولوجيست، ده حتى لو مريض عايز داتا هيلاقي داتا. فهي الفكرة ان هم they are trying to support the recovery and the prevention in all the ways that are possible. شكرا جزيلا، وان شاء الله يعني نلاقي كتير من العضويات ان شاء الله.